Thank you for joining us today. It's great to welcome so many of you. For those new to the National Association for Healthcare Quality, we define the standard of excellence for the profession. We also provide healthcare quality professionals with the support and tools they need to meet the standard. Through our work, we strive to reduce waste, improve outcomes, and demonstrate that professionals like you are indispensable members of the healthcare team. Today, we're happy to tell you about NAHQ's Q Essentials and its most recent installment, Quality Review and Accountability. As healthcare is evolving, it is more important than ever for the profession and the healthcare professionals to be at the table, supporting and leading this evolution.
NAHQ has been a driving force in healthcare and improving health outcomes. In the early 1980s, NAHQ launched the first and only accredited certification for healthcare quality, the CPHQ, the Certified Professional in Healthcare Quality. Today, more than 9,000 quality professionals have earned this important distinction. The CPHQ demonstrates one's expertise in the field. Professionals who hold this distinction showcase their commitment to securing the knowledge and competencies needed to be a strong player on the quality team. In the next year, NAHQ will have more than 10,000 active quality professionals holding the CPHQ. We have reached a tipping point, and the momentum for certification is strong. If you are not yet certified, this is an important step on your journey to getting and maintaining a seat at the table and demonstrating your personal commitment to the profession. With the certification in hand, quality professionals are primed to take their craft to the next level with Q Essentials. The CPHQ is not required for quality professionals to engage with the Q Essentials, but it will most certainly help as they work towards achieving the advanced and master level competencies.
Last year, we launched Q Essentials. This landmark initiative defines the advanced and the master level competencies for the profession of the healthcare quality. Our intent for Q Essentials is to provide a framework for ongoing professionals and organizational assessment and development. Today's quality professionals are facing pressures like never before. They're expected to work in a value-based purchasing environment where performance on healthcare and financial metrics are not just reported, they are measured, monitored, and improvement is just not expected, but it is required.
We are incredibly proud of Q Essentials and see it as a multi-purpose resource for both quality leaders and quality professionals. For quality leaders, it's a tool to assess your own skills and knowledge or your team's. It can inform the recruiting process to ensure you're filling the gaps within your workforce. For quality professionals, it's a tool that helps you identify opportunities for professional development. You can also use Q Essentials to help differentiate yourself and demonstrate the indispensable value you bring to the team and to your organization.
The Q Essentials cover these 6 topic areas: data analytics, population health and care transitions, performance and process improvement, regulatory and accreditation, quality review and accountability, and patient safety. We released quality review and accountability a few weeks ago, and patient safety will be available in Q1 of 2017. So why are these areas so important to the profession? I'll quickly talk about the first 4 installments before Stephanie talks about quality review and accountability. We work in a data-driven world. As healthcare quality professionals, we must understand and be competent in the domains of data management, statistical tools, and transforming data into information. Healthcare quality professionals use information within science of quality improvement to reduce cost, improve outcomes, expand access, and inform strategy. We must help others at all levels understand this vital information too. We serve as leaders, mentors, coaches, and consultants, transforming information into compelling visualization and narratives so that any audience at any level can clearly understand what is at stake and what path to take or not take. Healthcare quality professionals engage in population health management at many levels. As data stewards, they analyze population data to stratify and predict risk as well as identify trends and monitor outcomes. As process improvement experts, they evaluate operational and clinical processes, identify root causes of breakdowns, and redesign processes to improve care delivery. They design care transition across the continuum of care to optimize handoffs and facilitate interprofessional collaboration with care coordination. Healthcare professionals are the linchpins for collaborative work as organizations partner more and more with various interprofessional providers, payers, service organizations, and consumers to maintain and improve the health and wellness of all populations. The healthcare professionals' value-based approaches positions them for leadership roles in supporting and advancing the efficient, safe, and quality care of populations. Performance and process improvement is a core functional responsibility for healthcare quality professionals. It applies specific tools to gain insight into the organization and measure the effectiveness of its programs, processes, and workforce. It gives us the ability to impact healthcare delivery systems and guide our organizations to achieve optimal level of performance. As agents of change, healthcare quality professionals must be focused, results-driven, and able to collaborate and lead others in the quest to achieve and sustain operational and clinical excellence. Stephanie, I'll turn it over to you.
Thank you, Michael. Quality and patient safety are at the core of all healthcare regulations, accreditations, and standards. Healthcare quality professionals are integral to the organization's success in achieving and demonstrating conformance to relevant regulations and standards. Healthcare quality professionals offer a value-added depth of knowledge and expertise that can enable a healthcare organization to successfully and effectively meet the regulations, advance standards-based practice, and sustain a culture of continuous readiness. Healthcare quality professionals need broad knowledge of the regulatory and accreditation environment, the ability to identify relevant statutes, regulations, and standards, and skills and expertise to oversee their successful adoption and evaluation. Healthcare quality professionals must be prepared for the ever-changing healthcare regulation and accreditation landscape by developing a strong foundation to identify and appropriately apply regulations and accreditation standards in a wide variety of healthcare settings. Once again, QRA became available earlier this month. This competency area focuses on the need for a better understanding of how performance and outcomes-based measures are collected, interpreted, and distributed internally and externally within healthcare organizations. It will help healthcare quality professionals lead the way as you incorporate performance-based measures that are not only driving change and improvement, but also evaluate competence and calculate compensation. As healthcare costs continue to grow and the availability of resources decreases, healthcare quality needs competencies and healthcare payment models across the provider and payer continuum. In this new paradigm, the healthcare quality professional is both a partner and a key player in setting the organization's strategy. For example, some of the specific observable behaviors for this competency call for healthcare quality professionals to apply knowledge of focused professional practice evaluation, ongoing professional practice evaluation, and requisite structures and processes. They're also looked to manage performance and improvement opportunities from accountability reports and to ensure follow-through, and also demonstrating knowledge of the impact of healthcare payment models as they apply to quality measures and improvement programs. Competencies at this level are not garnered through osmosis. A deliberate commitment to the subject matter and training are important to attain this level of competency and savvy. Your peers are doing this work, and they're doing it well.
Yes, healthcare quality professionals are doing an excellent job. Another Q Essentials resource available to you are the at-work profiles. They are quick reads that highlight 3 healthcare quality professionals in each competency area. The profiles provide an overview of how they started their career, their current roles, and steps they've taken to enhance or expand their knowledge. These are perfect insights for those interested in the different career paths available in the profession to learn more about certification and higher education opportunities that will help advance a career or just to gain a better understanding of a competency area through a peer's experience. And when you're ready to make a move in the field or find your first job in the profession, you can start with NAHQ's Career Center, which you can access at www.nahq.org.
One of the healthcare quality professionals featured in the QRA at Work profiles is Rebecca Prisick. She's an analytical thinker with a desire to help people in healthcare settings, a combination that makes healthcare quality a perfect fit. Rebecca started her career in healthcare as the Assistant Activities Director at an assisted living facility in Clarkston, Michigan. She then moved on to serve in a practice administrator role for Clarkston Medical Group, and then as a program coordinator for a new outreach program at McLaren Health Plan. Currently, Rebecca is a provider performance specialist with Priority Health, where she serves as a liaison between accountable care organization, hospital executives, and provider organization. She utilizes business intelligence software to analyze cost data and identify emerging trends. She interprets and delivers cost of care reports and scorecards that inform the provider community of Priority's health quality improvement action plans. And she believes that the ability to collect, analyze, and interpret raw data is the most important and most necessary skill a healthcare quality professional can possess. This desire to continuously learn led Prisick to obtain the CPHQ credential and a Lean Six Sigma Black Belt certificate. She's now pursuing a master's in healthcare administration, which she will receive this December. All of these designations have expanded her skill set and enhanced her knowledge, helping her better communicate with colleagues, staying abreast of changes in healthcare, and understanding the implications of the data that she collects. After looking through Rebecca's profile and the others, you'll see these people are excelling, not just because of their natural talents. Though they are significant, they are excelling because they know that the new quality professional needs to evolve. And they have stepped up to the challenge, and so more and more they see the opportunity.
If you are looking to expand your knowledge on other healthcare quality topics, NAHQ can help. We have upcoming events in the next couple of months that you might be interested in, which include the Learning Labs, creating an accreditation framework for organizational compliance on November the 2nd. And if you're a NAHQ member, this online learning opportunity is free for you. I'll tell you more about that in a second. Membership is available to persons involved in the healthcare quality field, and one of the most important responsibilities we have as your professional home is removing barriers between members and content. And earlier this month, we did just that. Our members enjoyed a new benefit: complimentary access to more than 15 CPHQ CE credits annually through our live and on-demand learning labs. You have immediate access to a demand learning labs through the course catalog on the NAHQ website, and that's a value of more than $700 for these CPHQ CE hours. So if you're a NAHQ member, thank you. And remember, you have immediate access to our on-demand learning labs, and be sure to sign up for the next live event on November the 2nd. We also provide extensive educational programming for those new to the field to seasoned pros. Healthcare Principles, an online certification program, establishes a great foundation for those just starting out in healthcare quality. It helps them better understand healthcare quality and how they fit into the picture. For those planning to sit for the CPHQ exam, our CPHQ prep resources could be just what you need to feel as prepared as possible. With online learning courses, in-person workshops, books, and practice tests, you can find a study tool that works best for you. And as we've discussed, for advanced and master practitioners, we offer Healthcare Essentials, the essential competencies for healthcare quality professionals. Healthcare Essentials defines the expanding and emerging healthcare quality professional role of today and tomorrow. These programs and resources, along with our peer-to-peer networking, and member engagement platform provides healthcare quality professionals the end-to-end support they need to be successful in a fast-changing healthcare environment.
Speaking of networking, NAHQ Next, our annual conference, will make its return next year. It will take place September 18th through the 20th, 2017 in Cincinnati, Ohio. And on November 1st of this year, we're opening our NAHQ members-only presale. Not only will members take advantage of incredible savings, but they'll also reserve their spot at NAHQ Next, which we do expect to sell out. We look forward to seeing you at this can't-miss event in 2017, where you'll be able to learn from your peers will learn from you. You can talk with exhibitors who can offer solutions that will support your organization and help make your work life easier, and you can gain advanced knowledge in your career. Today is a new day for healthcare quality, and the profession of healthcare quality is more important than ever. Now is the time to demonstrate your commitment to quality, to the profession of healthcare quality, and to your own personal development and advancement. Quality cannot be improved without you. Start your journey today. Thank you. I'll open it up now for questions.
We'll now open it up for questions. If you can use the question function on GoTo, we will moderate questions. We have a few that have come in already. The first one is, do you offer preparation courses for preparing your certification? Stephanie?
Yes, NAHQ offers courses online and live. We get most of our users through the online content, which Michael did reference in the slides. I think this question actually came in right as or before he was promoting all of that wonderful content, but that can be found at NAHQ.org, and we have both online live courses, practice self-assessment exams, our Q Solutions book series, and other content as well. So we have a lot of things to help people get prepared.
Great. Our next question is, where can I get the at-work info?
The at-work profiles are also found on NAHQ.org. If you go to the website and search for Q Essentials, the at-work profiles can be found there. And we have them for quite a few positions at this point. At least 3 per competency area have been developed, and there's really interesting content there.
Great. The next question is, can we obtain a copy of this PowerPoint? After this session, we will be sharing the recording of this session as well as the slides. So we'll send those out to all attendees. The next question is, are there preparation question banks?
Yes, there is one question bank, and that is available via the NAHQ.org website. That is part of our exam prep materials, and we call that a practice test. Yeah, that's there have been a few different terms for it, but it is a practice test, and it has some retired questions in it. It's a really great study tool. We hear a lot of very, very positive feedback about that tool. So yes, that is available.
The next question we have, related to nursing education, I assume these materials can be used in educational settings, given proper citation to NAHQ. Is this correct?
So I believe that you're referencing the utilization of the HQ Essentials content. And what we have explained to individuals is that, yes, if you are presenting a presentation and would like to cite NAHQ as a reference, that's wonderful. We do not want anyone distributing the HQ Essentials independently or using them for commercial use. So you may use them as an individual to serve your individual needs at your institution, in a teaching environment, that's just fine. But what we want to make sure that we get proper approvals for would be things like if you are faculty at a university and the university seeks to use the content as part of their syllabus, then we would definitely need to have a conversation about that because this material is copyrighted. Additionally, if your organization was using this on a larger scale to create not job descriptions for one position, but maybe job descriptions for an entire healthcare enterprise, then we would want to talk about that too. We just want to make sure that this is for our personal membership use, and other use cases should just be run past us. And we definitely want to share the information, but we want to make sure we're doing that thoughtfully and that we're protecting our interests via copyright.
Thanks, Stephanie. Next question, how long do people usually take to get certified once they start the process? So we've done some research and asked our certificants and product purchasers how long generally do they spend preparing for the exam. And what we have found is that most people spend about 3 to 6 months studying and preparing. Once you apply for the exam, you have 90 days to sit for the exam. And so, usually within that time frame, people have the opportunity to prepare and access the exam. The next question we have is, with the NAHQ Essentials, are they offered to members with discounts, and is that an additional certification or status to the CPHQ?
I can answer that question. So the NAHQ Essentials is our competencies that we shared with you here today, and those have been printed and sent to our members in their home offices. Additionally, they're available online. Those are open not just to members at this point, but open to the public if a larger group would like to look at that content that is available at this point. In terms of a certification, we do not have an NAHQ Essentials certification. We do entertain questions about that fairly often, and we're trying to figure out what is the best path to make sure that we're offering the content in a meaningful way. For now, the best way is to actually reference the competencies, which we've shared, and also go on the NAHQ.org website into our education portal. We have a tremendous amount of content that is available now, just as promoted last week, free to members, and most of it is around the NAHQ Essentials content. So that's a really great resource for you. As a matter of fact, I received a message from a member just today who shared with me that having access to this content from the NAHQ Essentials framework was really like having a treasure trove of all of this content, because there's so many great talks and resources in the education portal that are really helping this person understand the NAHQ Essentials and all that they can do to improve their work in their organization. So definitely check that out.
Great. Will NAHQ offer preceptorships for novice CPHQs? We don't have any plans for that, but if you would like to follow up with Jessica directly or send something to info@nahq.org, we can try and get a little more information on what you were thinking. We don't have plans for that at the moment. Past and current focus is on acute primary hospital healthcare quality. Will NAHQ provide resources, support, training for quality professionals in long-term care? I'm a quality director for a Medicaid-managed long-term care organization.
So that's such an interesting question, and yes, our board has been having discussions related to the fact that obviously our roots are in acute care, but that healthcare is really extending to be not just delivered across the continuum, but managed across the continuum of all delivery settings. And long-term care is something that specifically we have had a good amount of dialogue. As a matter of fact, we have a partnership right now with Telegen, which is the Illinois-Iowa QIO, and we have a grant that's been funded through CMS that is actually training individuals in nursing homes with some basic quality principles and the QAPI standards as well. So we are exploring that space more and more, and as our board continues with strategic planning, I would expect that they would be headed in that direction, just because it's where the environment is going. And I think that when we talk about healthcare quality, we need to make sure that we're giving individuals content that helps them figure out how to use that in their setting. So as soon as we have more information, we'll be communicating that.
Great. The next question is, how often are the CPHQ exams offered and where? We offer the CPHQ exam throughout the year and based in the U.S. and internationally. If you're taking the exam in the U.S., it is offered throughout the calendar year except for on major holidays and in many locations throughout each state. Internationally, we offer the exam on a quarterly basis, and all of that information can be found on our website at cphq.org. The next question is, do you have concrete clinical examples of HQ Essentials? Where are these available?
So the concrete clinical examples would really come from our learning labs. Learning labs are webinar-based content that really dig into the HQ Essentials and offer practical, clinical, and administrative solutions for how to execute the Q Essentials. So if you go to our website at NAHQ.org and go into our learning portal, you will see the learning labs there. And if you are a NAHQ member, they are now free to you. So not only the current ones that we'll be offering live moving forward, but the entire archived inventory is available as well. So check that out for those examples.
This question builds onto the last, and are there CEUs to complete annually?
So is that building onto the last question? I'm not quite clear. I think the question is related to CPHQ, CEUs to complete annually.
I'm not exactly sure. Sorry, we interpreted that separately. So for the CPHQ, you do need to complete CEUs, and you, as part of your recertification, it is 30 hours over a 2-year process. However, we do have a lot of CEUs available that do support the HQ Essentials material through our learning labs, which we just discussed.
Right. And again, if you are seeking your CPHQ and you are looking for those hours, those are now through our learning labs and through our JHQ CE included in the membership dues structure.
The next question is, are the training courses NAHQ offers online enough to prepare myself for the exam?
I actually want to ask Michael that question because I think that Michael would have a great insight. Michael is a CPHQ, and he has been involved in some of our training. So, Michael, would you like to talk about the prep process and if you think that the content online is sufficient to get somebody ready for that, and if not, what else would you suggest?
Oh, absolutely. Thanks. It's definitely a start, and certainly what you want to do is to be able to use some of the other resources that are listed out on the website. There's other books that are available that do help you prepare for that. So the courses that NAHQ offered is, again, a great start, but there are other things that you would want to look at, again, looking at that list of books that are available.
Okay, thank you.
Great. The next question is, I have been away from acute care quality for several years. What is your recommendation for a best approach to refresh skill sets such as regulation?
So I think actually I'm going to have Michael, if you can answer that one as well. What is a great way for someone who's been away from acute care to really jump back in and figure out where to get up to speed on the regulations? There's a lot going on.
Yeah, there's definitely a lot going on, and every day it seems like new regulations and so forth come out there. So I'm assuming that with the regulations, they're talking about the CMS Conditions Participation that's required for hospitals. And those are available online. You can go out and Google those so you can look at your state operations manual, which is always a great place to start. There are a plethora of newsletters that one can sign up for that also assist with that. If you are Joint Commission accredited, they also have newsletters that come out on a weekly basis that will help you keep up with certainly the accreditation standards there. And so I get a lot of newsletters in my email boxes, and I sign up for the CMS newsletters that come out, and some of the other organizations that help us out with that. The SIGs that we have that are part of NAHQ, a lot of folks do go in and discuss some of those as well. So that's a good resource for you to do that. I can't think of anything else at the moment other than, again, if you're talking about regulations, CMS is the best resource.
Great, thank you, Michael. The next question, I'm not currently working in quality yet, but I'm very interested in taking the CPHQ early in 2017. Would membership be available to me as not a direct quality professional?
Yes, so membership is open to individuals with clinical or non-clinical backgrounds, and the CPHQ is as well. So there is a bit of criteria that is that makes the certification and open to most anyone who has an interest in pursuing quality. So we are happy to see that more and more clinicians are engaging, and also that more and more non-clinicians are engaging in healthcare quality, and membership and certification are open to both.
Thanks. The next question is there guidance for the novice of where to start and what to continue for this direction?
Yes, I'm so glad that you asked that question. NAHQ has recently offered a Healthcare Quality Principles course. This is a course that is offered online, and we just launched it about a month ago. We had a great response, and within the first week, I believe, we had someone who had actually completed a couple people who had completed the program and actually who have achieved a certificate in the Principles course. So that was very exciting for us, and we have lots and lots of people registered to complete that as well. So I feel like the Principles course is a good entree into the CPHQ content and really does help individuals get a baseline of knowledge. And that's great too, not only for people who are new to quality, who are looking to kind of graduate through, the Principles to CPHQ to really leveraging the HQ essentials, but also HQ Principles is great for those who are not quality professionals but who work in a healthcare environment. So many of our directors of quality will tell us that, they're not sure that some of their clinicians understand healthcare quality as well as they should, and this is a great resource for them as well. So definitely go online and check out our HQ Principles content, and I think that would be a wonderful place for you to start.
Thanks. If we are already a CPHQ and want to be a part of the larger dialogue and strategic plan at NAHQ, is there a way to participate, and what do you recommend?
Yeah, I see that, and I see also the example focused on long-term care, right? So NAHQ is always open to hearing its members' feedback and help pointing us in the right directions. If you have information that you would like to share with us generally, of course, send it to the info inbox. You can always access me, this is Stephanie Mercado, as the Executive Director, and any of our board members. And all that information is on our website. So you can have as much input as you would like into that process. We are going through currently a methodical process to do external environmental scanning. We are seeking out VIP SMEs. And in your inbox in the next couple of weeks, a couple of days actually, I believe, we will be sending a member survey. And we are seeking information not only about how you think NAHQ is meeting the needs that you have as a member and as a CPHQ, but also what are those things that you think that we need to be keeping on our radar? What keeps you up at night? What are the most pressing issues? And what do you need NAHQ to do to support those needs? Those are the last couple questions of the survey, so hang on as you're going through that survey to give us a holistic view of that. But we are seeking that input from our members and external sources. But if specifically you have any feedback, reach out to myself or anyone on the board and provide it, because that's what we're here to do, is to serve your needs.
Thanks. The next question is, what book or study guide do you recommend to start with? I think this is referring to the CPHQ exam prep materials.
Yep, so we would highly recommend our Q Solutions book series, and you can access that on our website. It's a great overview of quality, and we're real proud of that work product.
Great. Can NAHQ help me get in contact with other HQPs who are currently working on CABG and AMI bundled payment programs and alternative payment models?
Yes, we have to think about how to do that. But one way for you to do that at present is to join the NAHQ network. We do have online communities, and you can join a variety of them, and you can actually query your peers on that. And a lot of times they'll pop back and say, oh, yes, I am working on that, and I can help you out. Here's an example of what I've done. So go ahead. I would recommend that you first try those communities through the NAHQ network. And if you are having trouble in any way, definitely reach out to us through info@nahq.org, and we will do our best to point you in the right direction.
All right, it looks like that has wrapped up our questions. If you do have additional questions at any time, please feel free to email us at info@NAHQ.org, and someone will get back to you. Thank you again for joining us today, and we hope to be your professional home and a great resource to you. Thanks, and have a great day.